So if you're planning to have corrective eye surgery, whether that be LASIK, PRK, SMILE, ICL, or even cataract surgery, then the healing of the eye is super important, right? And you don't want to make a mistake and end up with a poor visual outcome or having the eyes feel irritated afterward, right? You don't want worse dry eye symptoms. So I recently had my own eye surgery. I ended up having ICL implants. This is an implanted lens put inside of my eyes. And in preparation for my own surgery, I dug into the research. I wanted to read everything I could about how to optimize my ocular health, the healing of my eye, and the ocular surface so I could have the best possible outcome. So in today's video, I want to share the most common mistakes that I see people make after having a corrective eye surgery, and then share what tips I've learned about how you can optimize the ocular surface and have the best possible outcomes. Now, again, today we're talking about the mistakes that people make after having their surgery, but we also did a video just recently about how to optimize the eye's health before your surgery. So if you are thinking about having an eye surgery soon, or maybe in the near future, then definitely don't miss that video. And if you didn't catch that, then I will put a link to that in the top of the description in the show notes. Now, before we really start diving into the common mistakes and talking about the tips and everything, I do just want to call out that eye surgery is very complex and everybody's eyes are different, right? Left eye, right eye are different. And also everybody's health is different. And so while we're talking about these mistakes and sharing these tips here today, I just think it's always important to call out that don't just take my word for it. It's really important to talk to your surgeon, to talk to your eye doctors, whoever's co-managing with your surgeon at the clinical centers, and make sure that you talk with them about what they think is best for you based on your procedure and your individual eye health. With that being said, let's talk about eye surgery and what you can do to have the least problems and have the best outcomes. So the number one mistake that I see most patients make after corrective eye surgery is that they either stop or they miss taking some of their post-operative eye drops. The eye drops that are prescribed after an eye surgery are super important to keep taking and not miss a dosage. These eye drops usually contain antibiotics, they contain steroids or NSAIDs, non-steroidal anti-inflammatories, and this is to help not only prevent infection, but also to manage and control the inflammatory response inside of the eye. So even though some people think that, hey, I'm seeing great, my eyes feel great, I don't need to take these drops, no, you absolutely do, because oftentimes there is inflammation still inside of the eye and in the ocular tissues that is sort of smoldering. And if that inflammation goes unchecked, you can end up with some serious complications. So my biggest tip is one, definitely make sure you keep taking those eye drops. In fact, a lot of clinics will give out kind of a cheat sheet, something with check marks on it, so that you can, every time you take those eye drops, you can mark off that you actually got them. It's a good way to track, but also to shake your eye drop bottles. That's kind of my pro tip here for this first part, is to look at the side of the bottle, and it oftentimes will say to shake that eye drop. And that's because sometimes steroid medications, they fall out of solution when they're just sitting on the shelf. And so it's really important to shake it up for about 20 to 30 seconds before you put the eye drops in, because then you're going to get a more appropriate dosage of the steroid and you're going to have a better response to it. Now, the second most common mistake that I often see people make after having an eye surgery is they don't use artificial tears or a re-wetting drop. This is really important, I feel, because dryness after any eye surgery is actually very common. This happens because either the eye drops you use before surgery or during surgery can cause a lot of irritation or toxicity to the ocular surface. Also, the harsh lights and just the procedure itself can often cause irritation and dryness to that ocular surface. And so it does need to heal. So after an eye surgery, after the numbing drops and everything wear off, people often do feel their eyes feel irritated, they feel scratchy, and that's because the eye's surface has been irritated and again needs to heal. And so using re-wetting drops is going to be really important. Also, during all these post-operative drops that we just talked about in tip number one, the most common mistake is that those drops often do also have preservatives. And those preservatives are essential so that those drops obviously don't get contaminated, but those preservatives are known to be pretty harsh on the ocular surface as well. And so using not just artificial tears, but ideally preservative-free artificial tears is going to help re-wet the surface of the eye, help with the healing, but also help reduce any irritation and discomfort. The big tip here is that you want to use the artificial tears around 3 to 4 times a day. That's been shown in the research to be beneficial for reducing these dry eye symptoms. But to space out these artificial tears versus using the prescription eye drops that we just talked about, right, the steroids, antibiotics, you want to space out these drops by about at least 5 minutes, sometimes up to 15, but that way you're not washing out the important prescription eye drops, the antibiotics and steroids. But using preservative-free or non-preserved artificial tears at least 3 to 4 times a day for the first month after having any major eye surgery is going to be strongly recommended. And again, the research shows positive clinical outcomes. And as always, with everything that we talk about here on the channel, anytime we talk about research, I always include links to that research in the description, in the show notes, if you ever want to read it yourself. So at least using artificial tears, again, 3 to 4 times a day for at least 1 month after the procedure, but sometimes even longer depending on the type of procedure. Something like LASIK, because LASIK is known to cause a lot more dry eye issues. Surgeons often recommend people to use eye drops for longer, closer to like 3 months, sometimes even up to 6 months, again, depending on your eye health and the type of procedure. Now, mistake number 3 is failure to follow up with your postoperative appointments. This is also, again, super important for healing of the eye, but also for doctors to manage and monitor that the eye's healing the way it should be and that there's no other complications. I know a lot of times patients, they may be having an excellent outcome, right? Their vision is fantastic. Their eyes are not in pain. They're not seeing anything abnormal. And so they think, hey, getting to see the eye doctor is like an hour away if you live super far away, but still it's super important to see the doctor. This is not just because we're checking for vision. We're actually checking to make sure the surface is healing correctly, but also internally inside the eye that everything's healing correctly there too. Things like eye pressure is an issue that we have to check for. People often do not feel the true pressure of the eye. And if the pressure after a surgery is elevated, you may not feel that there's a problem, but when there is elevated pressure inside the eye, that may increase the risk for something like glaucoma, where the nerve in the back of the eye gets damaged, and then people can eventually lose vision because of that. So again, super important to follow up on those visits and keep those appointments so the doctor can check that everything's okay. It also allows us to tailor medications and change things if needed. Also, I'll add in here this kind of a bonus tip at those follow-up appointments. If you notice anything changing with your eyesight, something abnormal, strange, like you're seeing new floaters in your vision, new flashes of light, any loss of vision, those are really important things to tell us, because that will change maybe how that exam goes. We'll think, oh, if you're having new flashes and floaters in your vision, that might tell us that there's something changing with the retina in the back of the eye. And so we may have to decide, okay, we need to dilate the eye. We need to take a better look at those structures and just make sure that everything's intact and healing appropriately. But again, make sure don't miss those follow-up appointments. Now, mistake number 4 is rubbing of the eyes or introducing contaminants to the eyes. Now, some people rub the eyes because they have allergies or there's irritation, and after a major surgery, the eyes again often feel a bit irritated. But any sort of rubbing may dislodge tissue from the eye, such as having LASIK eye surgery. There's a flap that's created. You don't want to dislodge or move that tissue. Or there's an incision site on the eye, and if they push hard on the eye, that may cause a burping of some of the fluid inside the eye to go through that wound, or they just introduce contaminants like bacteria that dramatically increase the risk of infection. And we don't want any of those things. So after some eye surgeries, like cataract surgery, for example, we often send patients home with a shield over the eye to protect it and discourage them from poking or rubbing the eye. I actually recommend people for those type of procedures to continue to use that eye shield every night while they're sleeping for at least the first week. And that's because I've had patients who have rubbed their eye unintentionally while they're sleeping, either with their hand, their fingers, or because they are a stomach sleeper and they sort of grind their face into the pillow. And so I recommend that they have that eye shield for that first week just to help the eyes heal and prevent any sort of other interruption like that. And along the same lines, for the same reasons, that's why I also recommend people not to use any cosmetics or non-essential items or products near the ocular surface, is because we don't want to introduce any possible infectious agents to the eyes. However, one bonus tip I'll add here is, while it's important to not push and rub really hard on the eyelids, it is still really important to clean the eyelids. It's generally recommended to not use water near the eyes because water like tap water still has microorganisms in it that could potentially cause infection on the eye, but it is recommended to clean the eyelids at least twice a day for up to 4 weeks after a major eye surgery with some sort of eyelid cleaning wipe. We've actually talked about this in previous other videos, but cleaning the eyelids not only removes biofilms and other microorganisms from the eye, but also any potential skin oils, sweat, and other things that can cause irritation. They've actually shown in publication in research studies that doing this can reduce dry eye symptoms, but also help stabilize or minimize meibomian gland dysfunction and even have improved visual outcomes when people are doing this, again, twice a day for at least up to 4 weeks after a procedure. Now, in preparation for my own eye surgery, both before and afterward, I primarily used eyelid wipes from the company called Mize, M-Y-Z-E. And I've loved Mize because they are a company that respect the science of eye care and dry eye. In fact, they have hired and consulted some of the leading dry eye and ocular surface disease experts in the world in order to formulate their products. Their eyelid wipes contain tea tree oil, which is not only an anti-inflammatory, has antiviral, antifungal properties, but is known to be effective at some of the most nasty microorganisms that affect the eyelids and the eyelashes. It also contains hyaluronic acid, which is moisturizing to the thin, delicate skin of the eyelids, but then they are preservative-free, which we've already talked about how important having preservative-free products are for the ocular surface and the eyelids, but most other products on the market of eyelid wipes do contain some harsh preservatives, and so this is a preservative-free option. For those few people out there who happen to be sensitive to tea tree oil or allergic to it, then they do also have alternatives. They also have options that have manuka honey and even hypochlorous acid, so I think there's something there for everybody. Now, for all these reasons, that is why we've now partnered with Mize and being able to offer you a special discount code. If you want to try out any of these products and start cleaning your eyelids and get a better daily eye health routine, then go to their website, helpmize.com. That's helpmize.com, and use our discount code DEH10 at checkout to save 10% off your order. Now, mistake number 5 that people often make after having an eye surgery, thankfully this one doesn't happen super often, but it still does happen. These are people who ignore the activity restrictions. We often give activity restrictions because there's always a higher risk of not only infection after a surgery, but also higher risk of complications. And so the type of recommendations we often make is, one, not to go swimming. Immediately after the surgery, there's often kind of a wound on the eye that needs to heal. And if you're somebody who likes to swim, then all the microorganisms in that water, whether that be a pool water, ocean water, lake water, can potentially get inside the eye and cause an infection. There's also activity restrictions about lifting heavy weights. I've seen restrictions say at least 50, not to lift 50 pounds. I've even seen restrictions as light as don't lift heavier than 20 pounds. I think this is something that may be person to person, but anytime somebody lifts a heavier weight, we often do a Valsalva maneuver. This is where we tense up, we sometimes hold our breath, and when we do this, there may be an increased risk of a pressure spike inside of the eye, which could affect the healing. And so that's why we have people kind of avoid lifting heavy weights for at least a week after a lot of procedures. The other thing that people sometimes do, which is definitely a case-by-case basis, and that is to not go onto an airplane or fly. This is something that is more often related to any sort of retinal procedure or a procedure where sometimes a gas is put inside of the eye, because obviously if you go into a higher altitude, the pressure of that gas may expand or shrink and change. And so that is why it's often recommended to not fly immediately after a procedure. I would say for everybody, depending on the type of procedure, you need to ask your surgeon what they think is going to be appropriate, especially if you already have a flight or something planned. Talk to your surgeon about the specific surgery and if that is a risk or a complication. Now, the last section here I want to go into are just kind of general tips that help with healing of the eye, but also just words of wisdom so that you don't make a mistake that could jeopardize your vision, your eyesight after these sort of procedures. The first sort of tip is to wear sunglasses, or if you're someone who doesn't like sunglasses, you don't like the tinting, wear a clear safety safety eyeglasses for the first week, maybe longer after having these eye procedures. This is not only because of like the tinting effects of sunglasses being more comfortable. Some people are more light sensitive after certain eye procedures, but it's really for the protective effect. It's because sunlight, UV light from the sun, harsh ultraviolet light, does slow down the healing of the corneal surface. And so after procedures like LASIK eye surgery, a lot of surgeons do recommend to wear sunlight protection whenever you are outside in harsh UV light environments. Again, if you're somebody who doesn't like tinting, that's okay. You can get safety goggles that are often made of a polycarbonate plastic that have UV light protection. Some surgeries, we even give patients specifically designed UV light sunglasses or clear plastic UV light protecting lenses, depending on the type of procedure. Otherwise, same thing if you're just in a windy, dusty environment. There's a lot of pollen, allergens outside. Smoke, if you're somebody who sits around a campfire, maybe in the summertime, same sort of thing. Those environments can also irritate the ocular surface and cause and induce more dry eye symptoms. So again, just be aware of your environment and consider wearing protective glasses. In addition to this, just to help with healing, as I talked about in my previous video about how to prep for eye surgery, is about prioritizing getting good sleep. Getting good sleep before a surgery is important for healing, but also afterward. If you're somebody who knows you're a light sleeper or you've got a busy lifestyle, I just encourage you to try to shift your lifestyle to prioritize your sleep. Go to bed a little bit earlier, be okay sleeping in a little bit longer until you naturally wake up. Be aware of how much light you're exposing, especially artificial light in the evenings, whether it be from a phone or from your overhead lighting. Try to make these actionable steps. Know that even one night of poor sleep has been shown to alter the tear chemistry and induce dry eye symptoms. And so again, it's important to really focus on having good, restful sleep. The next tip is to make sure you let your surgeons know about all the medications that you take. Not just medications, but also if you're taking any sort of supplements of any kind. And this is important because I know some people come in to see your eye doctor and they think, oh, this is your eyes, or maybe you just want glasses or contact lenses or something like that. And you think, oh, they don't need to know about my heart medication or that I'm taking a medication for my prostate, for example. But no, you absolutely do want to let your doctors know of everything that you're taking, because a lot of medications out there can affect the eyes or interrupt surgeries in a way. And so we actually did a video about that on YouTube just the other week about different medications that you would have no idea can affect the eyes. So if you haven't seen that, again, we'll put a link to that in the description below. But still really important to let your doctors know all the medications that you're taking. Also, another bonus tip, and this is something that eye doctors and surgeons often talk about frequently, and this is about setting proper expectations. We don't ever want to oversell an outcome or a procedure to somebody, especially if it's an elective procedure such as LASIK, PRK, even ICL like I had. We always want to over-deliver, right? So setting the expectations is really important. And I think some people, because they've heard of all these amazing success stories of something like LASIK that has such a fast, immediate recovery, like a lot of times people come out of that procedure just sitting up from the procedure itself, and within 10, 20 minutes, they're seeing 20/20. And I think that set people's expectations almost too high sometimes. For a lot of eye procedures, especially invasive procedures like cataract surgery, for example, we have to go deeper inside of the eye. There's often a lot more inflammation that occurs. And because of that, we often don't see immediate 20/20 vision that first day or even the next day. It often is a bit more fuzzy the first few days and gradually gets better and better over the course of the first week. So again, this depends on the type of procedure, your eye health, how advanced something like the cataracts may be. And so it's definitely a case-by-case basis. So my encouragement to you is that if you're having these procedures, just make sure to have that conversation with the doctor so that you know what to expect. Do you expect your vision to be 20/20 the next day? Or do they expect your vision to be, no, it's going to be a little bit fuzzier the first few days, but we expect you to have excellent vision by the end of 1 week or 2 weeks? Have that conversation so that you understand what your life is going to be like for that first few days to maybe the first week after the procedure. But I think just having that good expectation is going to set you up for much better success. And then my last big tip here for today is no matter what your outcome is from having an eye procedure, do not fail to keep having annual eye examinations. And this is important because I know a lot of people, they'll get LASIK or they'll have cataract surgery or something, and they're seeing amazing afterward. That's the outcome we want. We want people to be happy with their vision. They want to see fantastic, like myself after my ICL surgery. I'm seeing 2015, better than 2020. It looks amazing. However, I know that there's still many eye diseases that could sneak up on me in my lifetime. For example, glaucoma runs in my family. And so it's really important for me to not only have my eye pressures checked, but for a doctor to evaluate my optic nerve to make sure that I'm not developing that condition and that we are proactive about catching it and potentially treating it before I ever have vision loss if I ever do develop that condition. And so the only way we're going to catch that for myself and for you is to keep having regular eye exams. In fact, many surgical centers now have, like, for LASIK, they have, a lifetime touch-up sort of thing that they may offer as long as you consistently have annual eye exams and maintain those records. And that's part of their kind of initiative to promote the importance of continuing to have eye exams. Even if your vision is perfect, again, there's so much we can catch with an eye exam. So yeah, that's my final tip. Now, I know we covered a lot in today's episode, but please feel free to drop your questions or comments down below. As well as if you're an eye care provider, please feel free to share what big common mistakes that you see people make or any sort of extra tips that you have after having an eye surgery. Put those in the comments as well, because I'd love to hear another doctor's perspective. Otherwise, I want to say if you have been getting value out of our show, if you learned something new, something that's helpful, and you appreciate it, please do us a favor by hitting the subscribe button or follow buttons, because that's going to help us grow our channel and help us achieve our mission of reaching more people to help them see not only the best today, but also for tomorrow. So with that being said, thank you so much for being here. Keep an eye on it, and I look forward to seeing you in that next episode.